Welcome back to the Now Morning Show. It's 18 minutes past the hour of 6 o'clock, and it's time to shine a spotlight on a road trip that's going to enhance your wellness.
We are getting ready to take a road trip to better health. This morning, I want to welcome Dr. Sandi Arthur, the manager of the health promotion at the SWRHA, this morning joining us via Zoom. Good morning to you, Dr. Arthur.
Hi, good morning, and thank you for having me today.
Not a problem. We always love having you on the Now Morning Show to hear about all the updates and all the things that you guys are doing down at the SWRHA. Tell me about the road trip. What was the concept behind it, and how has it been going?
This road trip was conceptualized late in 2023 by primary care physicians who saw the need to provide a service for persons in the community who may not necessarily be able to come during the regular Monday to Friday hours, but still needed to have certain checks done to screen them and to see if we can pick up chronic illnesses faster, earlier, so that we can intervene on them. So in January 2024, we would have rolled out this road trip to better health at the Flanagan Town Health Center. And really and truly, it is a one-stop shop for persons, and it is held on a Saturday morning between the hours of 9 a.m. to 1 p.m. And there's a full cadre of services that allows persons without an appointment to just walk in, and if they desire to have women's health checks done, they can do so. Men's health checks, that is also done. We also cater to persons who may have missed their immunizations for their children and they need to catch up on them. So we have that as well. And in addition to that, we have the allied support services. So nutrition, medical social worker, mental health personnel, your primary care doctors, your district health visitors, your nurses. We're all there in one space on one day to provide you with tools to better health.
Fantastic. What was the response like from the communities that you visited so far?
It has been a mixed response so far, in that some areas you get a greater turnout than others. But I think it just shows us that there are different needs in different areas across the SWRHA. And it is an expansive area, so we've been able to complete up to date 17, and we're on our 16, and we're on our 17th one this weekend at the Labray Health Center.
All right, so this weekend we're getting ready to head to the Labray Health Center. Same timing, 9 a.m. to 1 p.m.
9 a.m. to 1 p.m. and all are welcome. We have something for every member of the family. So whether you are in arms or whether you are up and about and working, or you're home retired, there's something for you there that you can access.
Tell me about how the education aspect of it, because you mentioned just now the nutrition, you mentioned the mental health professionals being there as well. But tell me, how has the health education aspect of the road trip been going?
Health education has been very good. Each and every category of staff will offer education in their realm. So whether it is you have your vitals done, you're noted to have blood pressure is elevated or blood sugar is elevated, you'll see your doctor one time. They will do education from their viewpoint. They will then encourage you to visit with the nutrition and dietetic staff, because we have registered dietitians on board on the day. They would do their education aspect as well. And for some persons, they need a little bit of help in how to cope with living with a chronic illness and carrying out their day-to-day lives. And that's where medical social workers come in, because they offer counseling as well in those areas, giving you tools and equipping you so that you would be able to manage your condition while still enjoying life. Because at the end of the day, the idea behind this is for persons to have a good quality of life and to live life well.
Most definitely.
If they're well and have no problems, we're happy and we encourage them to remain well. If we detect something, we ensure that they get linked to the necessary services that they may have to move on to in another area of the SWRHA.
Okay. Now, previously, the Ministry of Health has always been saying that we have an increased number of NCDs, and we've been warning people against NCDs. Do you see that playing out when you do the road trips and visit the different communities?
Yeah, so NCDs continue to be a challenge for all of us. It really is pervasive throughout all of society. whether it's in the form of something like diabetes or hypertension, even depression. We see more mental health disorders as well. So having something like this that allows persons to be able to detect, because we do things like depression screening, anxiety screening on the day with our mental health providers and their psychologists available, so that if there is a need to initiate any therapy at that time, it is done, and then they're also linked to the appropriate clinic so they can follow up. So it is something that continues to be a challenge, and we continue to advocate persons to become more aware of what may be their risks based on their age, based on their family history, and encourage them to do the necessary health checks. I think that's one of our shortfalls in the Caribbean as a whole. We're not very proactive, more reactive, but we're encouraging persons now to be a bit more proactive in terms of you're feeling well, but still come and get that check done, because oftentimes many of these chronic illnesses have no symptoms initially. So you are going about your daily business and you feel well, but you may very well be walking around with a blood sugar of 300 unknowingly, because the body has its ways of adapting until it can no longer adapt.
Most definitely. How often should we be doing these checks, Doc?
Pardon?
How often should we be doing these checks, even though we're feeling well?
So for the average adult, if they're well and they have no conditions identified, we would advise that they do these health checks once a year.
Okay.
However, if we do identify a challenge and it requires some follow up, then we will encourage persons to follow the advice of their healthcare provider. Because some persons we may need to see more often, and others we don't need to. So some persons we may not just need to see twice a year. For some others, we may need to see them 4 times a year or even more. So it really depends on you, because we try to individualize the care, patient centered approach to you specifically, so that you get the best outcome for yourself.
Now, you mentioned earlier that you have something for every member of the family, whether it's babe in arms or whether you're in a walking chair. Like, either way, we have something for everybody. Tell me what you have specifically focused for men, because we are in November, which is Men's Mental Health Awareness Month. But I wanted to know, in terms of what you have specifically focused or geared towards men, to encourage them to come, and what should they be taking part in?
Okay, so for men, we do general men's health checks. So that would include blood pressures, blood sugars. We also do some screening for the prostate as well. I know that's a big one and a touchy one for many men, but we try to include that because we know that prostate cancer is the leading cause of cancer in men in Trinidad and Tobago, and we want to ensure that we treat our men well and that we detect any issues early for them. They are also able to have nutritional advice that is tailored specifically to a man's needs. So it's not like everyone gets the same blanket coverage for nutrition. It is tailored specifically to a man's needs. Likewise, the same would be done if they would visit the medical social worker or the mental health person or even one of our nurses. So
Absolutely
they are
fantastic.
catered to holistically. We also have vaccinations for all adults, like the influenza. We're in the flu season. So that's just a little plug to remind persons we're in the flu season and the seasonal vaccine is available for use.
All right, nice. Should we be walking with anything in particular when coming to the road trip?
You walk with yourself and just one form of ID. If persons desire to have, for example, their HIV test done, that is something they require because we don't use names for HIV testing. We use a code, and we want you to make sure you bring in your ID card for when we do that testing for you, because that counseling and screening is also available and you get your results within 15 to 20 minutes.
All right, fantastic. Any other specific tests that might be of interest to the general public that they might want to know? All right, I can definitely get this one if I come down to Liberty Health Center this weekend.
Okay, so the other tests that I would not have mentioned before are tailored specifically to you. So if it is that when you come and your basic screening reveals that you need more, then you are sent on for that up as needed. It wouldn't be the same for everyone.
Okay.
And just to also remind persons, because I said earlier that we have immunizations available for everyone, the children who are still within the 0 to 5 age range, for their primary immunization immunization schedule, when they're coming, they need to walk with their immunization card.
Okay. And if you don't have an immunization card, can you still come and get one there or no?
So for the children, so this is specifically for those children between 0 to 5 years of age. If it is that a parent has lost the immunization card, then we would have to let that person be seen. If it's not their regular health center, then they would have to go back to their regular health center because it's documented in the notes there. However, for example, if you're coming on Saturday to the Library Health Center and that is your base or your home health center, your notes would be available and we'll be able to look back at those notes so that we can see what has been given, what has not been given. But that's specifically for the 0 to 5 age group. For the adults, if you're just coming for your flu vaccine, because that's a seasonal vaccine, then there's no need to walk with an immunization card.
Okay.
We would usually check the immunization card if you want to update your tetanus, because the tetanus is done every 10 years.
Okay, fantastic. So we know that for sure. It's happening from 9 a.m. to 1 p.m. this coming Saturday at the SWRHA Health Center. Anything else we need to know before we wrap this morning, Doc?
No, you just need to come out and be willing and ready to do your test and screening. Our staff is there. They are very excited about the trip. Specifically, this health center, the nurse from the center, she called back. She said, "Hey, I need some more flyers." So we're really encouraging you because you've been informed about it to come out and be a part of this road trip to better health.
All right. Well, let me say thank you and the team at the SWRHA for the work that you've been doing and for taking this initiative to take the health education to the public and the testing to the public so that people who may not be able to make it to the hospital are able to get the services and get the testing and get the attention that they may need to be able to sort out whatever challenges or take front, as they say. So thank you very much for the work that you're doing.
Thank you for having me and have a good day, everyone.
You as well. Take care. Ladies and gentlemen, that's Dr. Sandi Arthur, the manager of the Health Promotion Unit at the SWRHA, letting us know what's getting ready to happen this coming Saturday at the SWRHA Health Center from 9 a.m. to 1 p.m. It's a road trip to a better health. You can go and get all your testing done, you can go and get your checkups, and you can do it all for free courtesy the SWRHA. We're taking a quick break and we come back with more in our morning show. Stick around.
Come let we go.